Hi, Toby Kohler back again with Mayo Men's Health Moment from Rochester, Minnesota. Today we're going to talk about erectile dysfunction, otherwise known as ED. What is ED or erectile dysfunction? Well, the technical definition of erectile dysfunction is the inability to get and keep an erection firm enough for sex. So the symptoms men get when they can't get erections include both getting and keeping the erections, but also reduced sexual desire. This is not surprising. Nobody wants to play baseball if they're going to strike out all the whole time. So essentially, once men have doubts or reservations about getting erections, they will have less desire for sex, which often returns when we can fix those erections. Symptoms for ED tend to occur with both masturbation and partnered sex. If you're getting normal erections with masturbation, but not with partnered sex, you may have a bit of performance anxiety going on or some anxiety about the relationship, etc. Also, true ED typically lasts for greater than 3 to 6 months. And finally, a little bit more about performance anxiety. So it is very common for young men especially to have problems with erections after they have a bad night. Maybe they drank too much alcohol that night, maybe they were with a new partner, etc. Once somebody starts worrying about getting erections, you start to make adrenaline. When you make adrenaline, that's bad for the penis, and you won't be able to get an erection when you're worried about it. So often, young men, they'll have kind of a short-term problem with erections, which happens to most guys, which will get better with a little bit more confidence, maybe some medications for short-term. How common is erectile dysfunction? So this is data out of the American Journal of Medicine from 2007, and it shows that the overall kind of take-home prevalence or total problems with erections of all men in America in this study, which is a sample of about 2,000 guys, was about 20% for all guys ages 18 to 80. Clearly, this gets more common as you get older. If you look at the bottom right of the slide here, 70% of 70-year-olds have problems with erections, or 44% of 60 to 69-year-olds have problems with erections. 15% of men ages 40 to 60 have problems with erections. Now, depending on which textbooks you read, this is actually a probably conservative estimate, meaning that most people think that erectile dysfunction is more common. Some people remember the prevalence or commonness of erectile dysfunction as equaling the decade of life. So 50% of 50-year-olds will have problems with erections, 60% of 60-year-olds, etc. So overall, very common, nothing to be embarrassed about. How does the penis work? Well, we're not going to go into detailed anatomy, but what you see pictured here is both a flaccid and erect penis. So this is the flaccid side, and this is the erect side. So what happens, there's stimulation occurring that's occurring off screen. So the nerves have to be stimulated. That can be visual stimulation, physical touch, that kind of thing. And then what happens is that the smooth muscle of the penis relaxes, which allows these blood vessels here to dilate, which brings blood into the penis, and so the penis expands. Then what has to also happen to keep an erection is that this outside layer of the penis right here, this is the strength layer, this has to compress the veins between the erect penis and this layer to keep the blood trapped in there. So that's venous trapping. So all in all, you need to have 3 things to get an erection. 1, the smooth muscle has to relax. 2, blood has to flow into the penis. And 3, blood has to be trapped there. There are many, many things that can make this system go wrong, which will be covered in another video. What other videos are available about ED, erectile dysfunction, from Mayo Men's Health Moment or from the website? Well, a lot. You can learn about what leads to getting erectile dysfunction, what are the risk factors. What about some more biology lessons? Can the penis change size? Absolutely. It can shrink if you don't use it. Is ED normal with aging? The answer is yes and no. Watch the video to learn more. What kind of treatments are out there, both surgical and non-surgical? Spoiler alert, lifestyle changes works for the penis. So if you quit smoking, lose weight, exercise, the erections will get better. Also, you can learn more about how pills help with erections, what shots you can inject into the penis to help get erections, what device you can use. Are there any treatments out there you should avoid? Spoiler alert, yes, there are many. And then finally, when you get to the point where the erectile dysfunction is severe, what are the surgical options? And so you can find all these videos on the site or available in the Mayo Men's Health Moments series if you want to know more. I hope you've enjoyed this video on erectile dysfunction. As always, if you have questions or want to schedule an appointment with us, please call the number on the screen. This is Toby Kohler signing off from Mayo Men's Health Moment.